I like to think of the sinuses as something in a simple way. It's a closed, warm, dark, damp place where stagnation can develop, and it's no different than anything that has some sort of infection or some sort of process. If you can get it open to breathe and ventilate, it tends to air out, it tends to dry up, and things tend to get better. With the balloon, we advance a balloon into this closed cavity and we dilate the balloon. So if I'm bringing a balloon in through a little space and it's dilating it up, now that sinus has an open door. That sinus is allowed to aerate, it's allowed to breathe. So the day of the sinuplasty procedure, we typically will spray your nose with a decongestant to open things up. Then we'll spray a topical decongestant with an anesthetic medicine in it to start the numbing process. We apply a locally sourced anesthetic gel to the lining of your nose in the regions that we're going to be working, so that topically numbs the lining up. And then you look in the nose, you advance the device, a little guide wire is threaded into the sinus, and then the balloon is passed over the guide wire. Patients will sometimes feel some discomfort when the actual balloon is inflated. After the balloon's deflated and we withdraw the device, we get your nose cleaned up, suction out any mucus or discharge that may have come from a sinus, and we'll watch you for a little bit, make sure that you're doing well, and we send you home. We instruct patients to just take it easy, no lifting or straining, don't blow your nose for 48 hours. We may or may not place a patient on an antibiotic and or oral steroid dose pack to help with any potential swelling, and typically just tell you to take it easy for a few days, and you know, if you need to go to work the next day, you go to work the next day. Typically, the patients feel better in a lot of situations the day of the procedure. Certainly, within a few days, they're back to normal. Typically, we'll see the patients a week after the procedure. There may or may not be some scabbing or crusting in the nose. We'll clean that up, and certainly by a couple of weeks, everything's healed up completely, and patients are back to their full stride. In my experience, the results of the sinuplasty have been positive. I certainly have seen many people come back with a smile on their face. I don't feel like I used to. I don't have the headaches like I used to. Taking fewer nasal and sinus medications than I used to. And as a general rule, people, I think, are very satisfied. If you're interested in learning about this procedure, call our office or go to our website, fayent.com.